1. A certified hemodialysis biomedical technician is asked to mentor a new trainee on dialyzer reprocessing equipment. Which instructional strategy best ensures the trainee's long-term retention and safe practice? A. Demonstrating once and assigning independent practice. B. Requiring immediate, unsupervised performance. C. Utilizing guided practice with periodic feedback. D. Providing only written procedural documentation. 2. During evaluation of a dialysis water treatment system, the technician identifies a potential chlorine breakthrough. According to regulatory compliance standards, what should be the immediate response? A. Continue treatment until a supervisor confirms. B. Shut down the system and notify clinical staff. C. Record the finding, but wait for scheduled maintenance. D. Add extra carbon manually to the tank. 3. When developing a training curriculum for new dialysis staff, which principle of adult learning should be prioritized? A. Emphasizing rote memorization of procedures. B. Linking new concepts to prior professional experiences. C. Reducing opportunities for learner participation. D. Providing content without practical application. 4. A mentor observes that a trainee repeatedly misreads conductivity meters. Which evaluation method is most effective in identifying the learning gap? A. Oral questioning on water chemistry theory. B. Direct observation of meter reading performance. C. Review of technical manuals with the trainee. D. Providing a written test on equipment calibration. 5. The Centers for Medicare and Medicaid Services, CMS, requires water testing logs to be maintained. What is the primary purpose of this regulation? A. To provide data for future research studies. B. To ensure continuous compliance with safety standards. C. To reduce paperwork for facilities. D. To monitor technician performance only. 6. A dialysis unit upgrades its reverse osmosis system. To align with adult learning strategies, how should the biomedical technician train staff? A. Conduct interactive demonstrations with immediate hands-on practice. B. Provide only a technical manual for independent review. C. Require written essays on system function. D. Deliver a one-time lecture with no practice. 7. Which communication approach is most effective when explaining complex water treatment system alarms to non-technical nursing staff? A. Using highly technical jargon to emphasize accuracy. B. Relating alarms to patient safety and operational impact. C. Avoiding discussion and leaving interpretation to clinical staff. D. Providing detailed chemical equations behind alarm triggers. 8. When mentoring a new technician, which technique most effectively fosters independent problem-solving skills? Providing the solutions immediately to avoid mistakes. B. Encouraging questions and allowing guided trial and error. C. Limiting opportunities for the trainee to troubleshoot. D. Correcting errors without explanation. 9. In curriculum development for a hemodialysis biomedical training program, what element ensures alignment with regulatory compliance requirements? A. Inclusion of CMS and AAMI water quality standards. B. Focus solely on mechanical repair skills. C. Exclusion of infection control protocols. D. Emphasis only on cost-saving measures. 10. A facility is audited for Joint Commission compliance. Which documentation is most critical for the biomedical technician to provide? A. Daily logs of dialysate conductivity and pH. B. Personal notes on machine repairs. C. Verbal reports from clinical nurses. D. Informal checklists created by staff. 11. Which adult learning strategy best supports technicians who struggle with understanding schematic diagrams of dialysis machines? A. Breaking down diagrams into step-by-step processes with real equipment. B. Assigning independent memorization of schematic labels. C. requiring learners to read technical manuals without assistance. D. Providing only written multiple-choice quizzes. 12. A biomedical technician is asked to evaluate trainee competency in disinfecting dialysis machines. What method ensures the most accurate assessment? A. Written examination on chemical properties. B. Direct observation of the disinfection procedure. C. Self-reported confidence rating. D. Group discussion of disinfection theory. 13. A dialysis center experiences recurring low conductivity alarms. As part of mentoring, how should a senior biomedical technician guide a junior technician? A. Assign independent troubleshooting without oversight. E. Review potential causes together and supervise diagnostic steps. C. Provide only theoretical explanations without practice. D. Instruct the junior to defer to nursing staff. 14. Which of the following best reflects regulatory compliance with AAMI standards regarding endotoxin levels in dialysis water? A. Must not exceed 0.25 EU per milliliter. B. Must not exceed 0.50 EU mle. C. Must not exceed 1.0 EU milliliter. D. Must not exceed 5.0 EU per milliliter. 15. When creating evaluation tools for technician training, which method best measures higher-order problem-solving skills? A. Multiple-choice knowledge tests. B. Case-based troubleshooting scenarios. C. Fill-in-the-blank technical definitions. D. Matching terms with definitions. 16. A dialysis machine fails its air leak test. Which action best reflects adherence to both technical procedure and regulatory standards? A. Bypass the alarm and continue operation. B. Tag the machine out of service and initiate repair. C. Ask clinical staff to override the alarm. D. Reset the machine repeatedly until test passes. 17. Which communication strategy most effectively resolves a conflict between clinical staff and a technician regarding machine downtime? A. Blaming clinical staff for improper use. B. Providing transparent explanations with evidence-based data. C. Avoiding discussion to reduce tension. D. Speaking only with supervisors, not staff. 18. In mentoring a new biomedical technician, which practice most directly supports skill mastery in water treatment monitoring? A. Encouraging reflective journaling after system checks. E. Assigning only theoretical readings on water chemistry. C. Prohibiting independent monitoring until full certification. D. Relying solely on online video demonstrations. 19. Which principle of adult learning is best applied when technicians are introduced to new infection control standards? A. Immediate relevance to their daily practice. B. Memorization of abstract principles. C. Passive listening with no interaction. D. Avoiding discussion of practical implications. 20. A biomedical technician notices a trainee skipping calibration steps. What evaluation method best identifies the cause? A. Observing workflow and asking the trainee to verbalize reasoning. E. Assigning a written test on calibration theory. C. Assuming knowledge gaps without investigation. D. Reviewing only the trainee's log entries. 21. Which curriculum design component ensures dialysis biomedical training addresses both compliance and performance outcomes? A. Clear learning objectives linked to regulatory standards. B. Sole reliance on manufacturers' promotional materials. C. Generalized lessons not tied to dialysis practice. D. Exclusive focus on equipment aesthetics. 22. What is the primary regulatory purpose of daily total chlorine testing in dialysis water systems? A. To monitor patient nutritional status. B. To prevent hemolysis and patient injury. C. To improve staff scheduling. D. To ensure financial efficiency. 23. When providing feedback to a trainee who improperly documents a repair, which communication approach is most effective? A. Giving specific, constructive feedback with examples. B. Criticizing in front of peers for accountability. C. Ignoring errors to maintain confidence. D. Providing only general comments without detail. 24. Which adult learning strategy enhances technician engagement during complex biomedical safety training? A. Scenario-based simulations of emergency events. B. Silent reading of technical manuals. C. Extended lectures without interaction. D. Memorization drills on terminology. 25. In evaluating technician competency with disinfection protocols, which standard must be met for compliance? A. Use of documented procedures aligned with CMS and AAMI guidelines. B. Reliance on technicians' memory of prior tasks. C. Informal verbal instructions without verification. D. Independent methods chosen by individual technicians. 26. When mentoring, what is the most effective way to develop critical thinking in troubleshooting dialysis machine malfunctions? A. Asking the trainee to predict outcomes of various interventions. Providing all answers without discussion. C. Limiting practice to simple, routine tasks. D. Allowing trainees to avoid complex systems. 27. Which communication skill is critical when documenting preventive maintenance reports for regulatory review? A. Use of precise, unambiguous technical terminology. B. Frequent use of personal shorthand. C. Inclusion of opinions instead of facts. D. Excluding dates to simplify entries.